Welcome back to Ask Dr. Antoine. Today we get to line with another fine doctor. We're here live at the Diabetes Association of Trinidad and Tobago Expo 2017. And we're hanging out on Ask Dr. Antoine. We're lining with Dr. Stephen Wells from New York.
Right.
Today we're making him a Trini. So he knows one Trini word, lineman. So you get to line with us. Dr. Wells, have you had a roti since you've been here?
I've had two.
Have you had doubles?
I have had one.
One, all right. So you know we're doing diabetes, right? So, and you're here at the Diabetes Association 2017 Expo, and you know I must ask, why?
Well, I'm here really to give information and also to learn how we can help. You know, a lot of people see a problem and never light a candle in the dark, but some of us really want to help. So I'm here both to educate and also to inform, but also to learn how we can help, because diabetes is something that affects us globally. So I believe that I have something to offer, and I hope that it will help Trinidad.
You know, our arrow is going up, and the diabetes arrow for the last 5 years have been steadily on the incline. Not just us, throughout the world. And we're trying, you and I, Dr. Hill Briggs, Professor Hill Briggs, we're all Dr. Claude Kahn, we're all trying to get that arrow downward. If we have to stand on it and jump on it. So now, what type of medicine do you practice?
All right, I'm a foot and ankle surgeon, and really I'm what they call a limb preservation, or I work in the area of limb salvage. So while diabetes is indeed going up globally, especially here in Trinidad, what is also going up is amputations. Mm-hmm. And that's an area where I'm an expert and where I really can help perhaps turn that arrow back down. Mm-hmm. So that's one of the major reasons why I'm here, because diabetes is definitely a debilitating disease, but once you amputate someone's limb, you accelerate their death. So there's something that we can do about that, very preventable, mm-hmm. and it's something we can do.
Now, I recently saw a patient who had a great toe amputation. And obviously, you amputate the great toe, all the ligaments shift.
True.
She can 4 years later, she can barely walk in a shoe. She inverts, walks on the side of her foot all the time. It's horrific. What may be a simple surgery to some. I'm not a surgeon, obviously. But now, how do you plan on going about decreasing those numbers?
Well, one of the first things is to understand how bad the problem is. And really, that's, in and of itself, the main problem. Although you have a problem with amputations here, the problem is you don't really know how bad it really is. That's the first problem.
You know why that is?
I really don't know.
We don't have an electronic medical record, right? I do in my practice. A lot of physicians do in their practice. But the public system, I do not believe, has an electronic medical record. So when I'm doing research, I just hit amputation, and everything with the word amputation pops up. We don't have that here. You have to go through physical charts.
Well, that's true, but I actually have worked with my IT team to come up with what I believe would be a solution. Mm-hmm. We have something called the Blue Link. It's an app that we now have that can be used to capture that information, and it can not really be a substitute for electronic medical record, but can help capture the data. Mm-hmm. And that's something that we can do. But that's really one of the key steps. But in addition to that, you have podiatrists here. What I find to be amazing is that they're relegated to the outskirts. That's really a tragedy. There are other islands I go to who have none. They would love to have the ones you have. So that's a real issue, how to bring the main players into the main forum, and also how to activate and give people the ability to solve the problem with the resources that you already have.
But let me ask you this. That word podiatry differs from country to country.
It does.
I train in the States. I've only been in Trinidad for a year, a little less than a year practicing. Podiatry in the States is a surgeon.
Sure.
Does all the surgical things. What have you found here in Trinidad? Educate me and the public about what a podiatrist who's in Trinidad, can they operate?
Right, let me be clear. So there are some misunderstandings and some restrictions across the Caribbean. And largely in the world, there are issues with understanding the role that podiatry plays. But let's make no mistake about it. The physician who is concerned about the issue of the foot is the podiatrist. And he really needs to be a part of what we call a multidisciplinary team.
I like that word.
Yeah.
That's what I do, multidisciplinary.
Right. So whatever role they play, and I advocate that they should get a certain level of training. We also are involved with doing that, making sure that the podiatrists across the Caribbean have the same ability to execute principles and information in the Caribbean as I in the States, so that we don't really have a two-tiered system. That's what we don't need. We don't need the Caribbean having one level of care while the other level of care is in the States. We want to make sure it's more uniform. So that's the first thing we do. We make sure that there's a structure. Second thing that we do is I'm actually taking podiatrists around the country and around the world with me to train with me, so that they now have a 360-degree view of what podiatry is in other areas and in other Caribbean islands. So
standardizing your care
Absolutely.
Internationally.
Absolutely.
I like that because, you know, we are trying to get nurse practitioners who I truly believe are the forefront, the frontline people in the fight for healthcare, especially primary care, in multiple specialties.
Right.
But they're on the front line. So too is our primary care doctors. They do all the heavy lifting, for lack of a better phrase.
Right.
They're the ones who are out there in the fight every day, and we need those guys. Now, you're here, you're doing a lecture today. Are you doing any outreach programs? Are you going through the clinics? Are you meeting with your other colleagues here in Trinidad, doing any training with them?
Absolutely. As a matter of fact, there's a podiatrist here that I'm working with. Her name is Leanne Huntley. She is a podiatrist here, one of 7 that I believe you have here. But she's one of the youngest ones, and she just finished her training in the UK. I'm actually working with her. We're actually setting up what we would call a referral system, because there are cases where she said there are things that I can't do. So she would refer them to me. But the goal is I want to be able to allow patients to stay in Trinidad. I don't mind coming to Trinidad to assist, but I really want to make sure the training is adequate here. But again, there's some training that's needed, so I'm working with some of the local podiatrists and seeing their patients. So that's really good. I want people in Trinidad to know that I'm really not coming here to really do concierge medicine or to do other kinds of. I'm here really to train, to educate, and empower. I believe that that's my job as a podiatrist, to help people really become empowered to know what they need to know and to do what they need to do.
Can your colleague who is trained in England do the types of surgeries that you do, that I know you do, that I have referred tons of patients to when I'm in the States?
Right.
Can your colleague here in Trinidad do those operations?
She cannot do those operations, but there's a simple reason why. But it's not a simple reason, but there are some restrictions, and they are political restrictions. But for the sake of Trinidad, those restrictions need to be lifted. And I think with those restrictions being lifted, she'll be able to be fully functional.
So we can definitely help on that, because truly at the end of the day, it's all about that diabetic.
Sure.
It's all about your mom and your dad, and that's why we're here, because we have to do something to get those numbers down.
That's right.
You know, everything that we can do to get this, to save that limb. You know, Professor Hill Briggs talked about she was a rehab in one of her professional lives. She was a rehab specialist, physical medicine rehab, and that's what I am. I'm a physical medicine and rehab physician. Right. There are not too many of us throughout the Caribbean, and those things are important. Even nurse practitioners, getting them on staff in the community here, those things are so important.
But see, that's the other thing too that I want to emphasize. We're not only training doctors, but we're also training nurses in wound care.
Yeah.
Because I realized that long before you have that amputation, you have a wound that won't heal. So you need to really work on both sides, the healing of the wound and also the preventative care for make sure that patients don't lose their limb.
So Dr. Wells, thank you for coming and joining us today on Ask Dr. Antoine. And, you know, there are a lot of professionals here this weekend at the Diabetes Association of Trinidad and Tobago Expo 2017 out here at Center of Excellence. And we are blessed because these people are here to help us. So, but mark this date on your calendar, November 12th, 2017. We're going to do Hands Across Trinidad and Tobago, and we're going to let everyone know what is your A1C, what's your blood pressure, because we are changing this. We have to change this. There's a crisis going on in Trinidad and Tobago, and we are here to stop it. And obviously, we can't do it by ourselves. We need your help, and all these great physicians throughout Trinidad and Tobago, we need their help too. and we're just here to pull too, and we're just another link on the chain. So again, join us next month for Ask Dr. Antoine. You have a question? Ask Dr. Antoine.